I wanted to tell you about the nurses on the 5th floor at CMC Maine. My husband was admitted there on December 3rd for surgery for colon cancer. It also happened to be the week of our anniversary, our wedding anniversary, which we knew would probably not be celebrated. And on the 5th of December, which is our actual anniversary, I walked into his room, and the nurses had helped him overnight decorate his room with a card and balloons to celebrate our anniversary. He had a huge smile on his face, and I asked him how he felt about it. He said he was relieved. He was relieved that he could do something for me. I had done so much for him. So I know those nurses had a very busy night, and they took time in their night to help him. I don't know how to thank them enough, because I know in their day that was just something they wanted to do, but it really was a turning point for the two of us, and it really brought me joy, something we had not felt for the past 6 months.
I have to recall a time with the administrative team at University City. We were in the midst of planning Hospital Week, Nurses Week, Doctors Week, and we were giving each other high fives, saying how much we enjoyed it, and somebody on the administrative team said, "When is HR Week?" And I was almost without words, like, who thinks about HR, you know? They had the leadership team and teammates send us e-cards to tell us thank you for what we do in HR. That's why what we do in HR is so special. It's a special feeling, but to be on the receiving end of that gratitude, I have a newfound respect for why that's important and why you gotta pour into people, because I felt it. And it's a feeling that I wouldn't trade.
It's a short and sweet story. It's about a flat tire, a closed auto center, and a 3.5-hour wait for the company to come to change my tire. And one of my teammates, Rhonda Wright, was there with me through it all. She wouldn't leave me. I kept on saying, "I'm fine, you know, you can go home," but she didn't. But on the way home that night, after the tire got changed, got fixed, I was on my way, I realized then that I had really received a special gift that day. And that was the gift of time. When you offer it to someone, and you offer it in a selfless way, and you expect nothing in response to it, to sit in a car for 3.5 hours is only something a very special person would do.
We were again at priority 1 status. We had a large amount of patients holding in the ED, a large number of patients coming out of surgery that needed inpatient beds, and we already had all of our inpatient beds filled. A number of us got together to try to figure out if there was an opportunity to open another space. Every leader that I called, it was nothing but helpfulness and nothing but, what can we do to help? Do you need more space? Can I help facilitate that? And we were able to open another unit, decompress the ED a little bit, and take care of the patients when we needed to. And that's the kind of thing every day that people do, and the teammates do the same thing. They all have to help each other to do the best they can for our patients. It just makes me feel thankful to get to be a part of people who do their best at the worst of times. And that's what our patients expect of us, and our teammates do it every single day.
Recently, my son had surgery at Charlotte One Day Surgery. When we were there, we had great care from our providers. When we walked around the corner going into pre-op, his name was written all over the bed in crayon on the sheets. And it just turned out to be a very good experience overall for him. They didn't necessarily know that I was an employee of the system, but I felt very much that we were in the best care possible. They went out of their way to do it, and it was just such a special moment for him to come and see that his name was written on his bed and that they had taken those extra steps. It felt really good.
So I received a call from a mother who remembered me from my previous role, and she asked if her daughter could do an 8th grade shadow program with me. We actually went to Human Resources first to meet with Arlene Cash, where the 8th grader had the chance to sit in a diversity and inclusion group. Then our second stop was to the simulation lab. When she first started, she said, "I think I want to go into HR." By the time we left, she said, "Is there such a thing called a physician who does business?" And I said, "Absolutely, it's called the Chief Medical Officer." She said, "I want to be a Chief Medical Officer." Representation matters, and the way our teammates influenced her decision is that they took so much time to explain to her how they do their work on her level. And so for that reason, our teammates are extremely reliable. And without their involvement and their engagement, who knows, wow, her life would have been different or unchanged.
It's been almost a year ago now. I had a situation where I was discovered in the respiratory power room face down. I was told that upon being found on the floor that I could have been out for anywhere from 10 to 15 minutes with no pulse, not breathing, 26 minutes of CPR, and multiple opportunities with the defibrillator to bring me back to a life-sustaining pulse. The training, their expertise, the way they responded, their caring, it could have been anybody, and they would probably done this, and I know they would have done the same for anybody. I guess extremely special teammates here in Pineville, and I'm honored to be a part of that team.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you for saving my life.